Welcome, everyone, to Authenticity with Alicia, the podcast where we explore burnout, the pressures of our society, and our quest for identity and authenticity. I'm Alicia, and today we are joined by Caylin Broome. I'm so excited to chat with her. She's a licensed clinical social worker in private practice based out in Atlanta. She specializes in grief trauma. We were just talking about our pets a little bit ago, so we're going to have a really fun conversation. I'm so grateful you're here today. Welcome.
Thank you, Alicia. I've been looking forward to this, so it's just nice to get to chat with you after we had been emailing back and forth.
Yes, I know. Sometimes it's
Yeah.
like so fun getting to like I see some of these people, on social media and just like so similar circles in the private practice world, the therapy world, and to like actually get to connect face to face is just such a joy. And I'm really excited about our chat today. I know you work with all sorts of things, but something that we were really wanting to focus on today is going to be grief and grief in adolescents and children. So I'm excited
Mhm.
to a very important topic, and so I'm very excited to get there. But I'm kind of curious, just like what your journey has been in private practice. Like, did you know you always
Yeah.
wanted to be a private practice therapist working in these types of specializations?
So, yes, yes and no. But mostly yes. So I kind of, you know how I feel like in our field, people say like, I didn't choose this work; it kind of chose me.
Mhm.
Um, so I myself was a grieving adolescent.
Yeah.
When I had my first introduction to therapy, I had a good friend of mine die my sophomore year of high school due to complications from epilepsy.
Mm,
And that was really, I had had grandparents die, and it was like, not to minimize what that is, but I think that my first peer death really was kind of just one of these moments of like, holy smokes, like
yeah.
this can happen. Like, I knew abstractly it did, but
Mhm.
so that was my first kind of foray into being in therapy as a client.
Yeah.
Was getting support with that. I had a couple of good therapists I worked with at that time, and I ended up taking a very meandering route myself toward becoming a licensed clinical social
Mhm.
worker. Worked in a lot of different settings, just kind of in my associate phase, medical nonprofit,
Mhm.
aging. I did a lot in aging, which is also another passion. But
Yeah.
yeah, so private practice, I was working in a group the last couple years, and then as of September of 2023, I am solo, and
Wow,
yeah,
congrats.
thanks. Thank you. Yeah. So this was always the ultimate goal to answer your
But
question.
it's a
But
journey, it sounds like. Like it's not
yeah.
something that, you wake up one day, you go to grad school, next day you have a thriving private practice. Like for some people that's
Yeah.
wonderful if that's happened to you, but it sounds like you've worked in a lot of different settings and
Yeah.
eventually
Mhm.
found your way here.
Yes, yes, for sure. It has been a little bit like shoots and ladders, right? But yeah, I honestly I can't imagine. It's one of those things where I'm like, I just don't know what else I would be doing if not this.
Yeah.
Really,
Ugh.
truly. Yeah.
Yeah. Well, and it definitely kind of
Mhm.
like hear that you get some of those personal experiences that I think a lot
Mhm.
of us therapists can relate to of just like, it's just like with research of like people say like, research is me search type things
Mhm.
where, we're humans first. We're going to be
Yeah.
impacted by things and it kind of just helps shape our worldview. And so for you, that definitely sounds like some of those past experiences helped you now be able to like be a space for other grieving
Mhm.
children and teens. Like I said, you work with all
Yeah.
sorts of folks, but I know that's like a
Yeah.
really special population for you.
Yeah, it really is. And I feel like there is a lot that is, so I'll say is being talked about more now in terms of trauma and interpersonal
Mm.
neurobiology. I don't know if you kind of are in that world too,
Yeah.
in your work. But yeah, just thinking about how for the longest time it seemed like one, kids were treated kind of like mini adults, right? But
Hmm.
two, there's this perception that kids didn't grieve because it
Mm.
doesn't look the same as adult grief, right?
Yes.
For kids, it's not going to be a situation where they're just like, you know, oh, I'm crying and looking at photos of my father, right? And really
Hmm.
missing him today, right? I feel like a lot of times parents will say things like, well, they seem okay because, they're playing and they're going to
Yeah.
school and, yada, yada, yada.
Hmm.
But on the flip, a lot of times big behaviors come out, right? When kids are
Yes.
having a strong emotion, they can't regulate it on their own, right? And they don't have words for what they're feeling. So usually it's the behavior. I feel like that brings
Yeah.
people into my office, and then we dig a little bit, and there's some loss, trauma attachment break, something like that.
Yeah. That was one
Yeah.
of my kind of questions as I was like thinking
Hmm.
about this podcast was what are
Yeah.
those differences? I 1,000% agree. I think there
Mhm.
has been a lot of misconceptions around childhood and adolescent grief and just grief in
Yeah.
general. I mean, it used to be a very
Yes.
like structured model, and now I know that's even evolved. And even
Yeah.
just like emotion regulation and expressing emotions, like there's just been a lot of changes in our society and our norms. And so, what are maybe some of those differences that kids and teens may have versus maybe older adults?
Yeah. Yeah. I would say probably the biggest difference is the ability to put it into words.
Mm,
Um, I feel like as adults, even for the most body unaware of us, emotion unaware of us, right? Because there's a spectrum there too
yeah.
in terms of how it sits for each of us. Most adults have the ability to say, okay, I think I know what's going on here. I think this is maybe more me than it is the
Yeah.
situation. Maybe I'm not mad at this person. I'm having this feel, right?
Yeah.
There's at least something there. And for a kid, it is, the vast majority of the time, it's going to come out like, regression in certain ways, right? If
Mm.
you have a young kid, maybe they're toileting, takes a step
Mhm.
back, or sleep difficulties, or, I hear this all the time, from parents of like, they used to be able to do this and now they can't anymore, right? In terms of
Interesting.
routines and, I don't know if there are any like specific target behaviors, right? Meltdowns, things like that.
Yeah.
Yeah, anxiety is another big one,
Mm.
that you see with kids, especially around separation, especially around nighttime,
Yeah.
because for that kid, I'm just gonna use the sake of a kid who's lost a parent just because I feel like that's what I see the most.
Mm.
It's, they have had that experience of separation that
Yeah.
is not going to be able to be reversed, separation that is permanent,
Yeah.
right? And it's kind of like every little separation can trigger that, right? Um, yeah, I have kiddos who's, I mean, might have wonderful, wonderful support systems, many caring adults involved in their life, right? And, which is what we want, right? And
Yeah.
even then, maybe being away from the primary caregiver is hard, right?
Yeah. Like both of
Mhm.
those can exist at once for sure. And what I'm hearing like this
100%.
common theme is and again, to kind of like nerd out a little bit of brain
Yeah.
development, right? Like when
Yes.
we are, what we know is when you're 26 and older, you're going to have a more developed frontal part of our brain, which is where lots of this logic and great thinking skills are
Mhm.
in. And we don't have that fully developed brain at 2 years
Oh,
old, 6 years old, even 17 years old. And
right.
so while we as adults are like, well, yeah, like we logically know that these things can happen and just because someone goes to sleep doesn't mean something bad's going to happen. That
Mhm.
kid literally like just cannot know. And that's to no
They
fault to
can.
them. That's their brain being where it's supposed to be.
Yes, and you know what? I think this is such and I'm glad that you took it this direction because this is one thing that I really feel, is a unique experience for
Mm.
kids who have lost someone at a young age, someone close to them
Mm.
at a young age is so you remember from grad school learning about, like, Piaget's stages of
Oh, yeah.
cognitive whatever, and, like, it's like I feel like that was in every class, and then it's like, if you asked me to name them right now, I would not be able to
No,
because I don't
same.
really use them a whole lot.
Same.
However, it's applicable here because
Mm.
there are kind of these, like, 5 let me look at my list because I think it is 5, 1, 2, 3, 4, 5 different domains of cognitive understanding of death.
Oh,
Um,
fascinating.
yes, yes. So the researchers who developed this model are Spies and Brent, I believe is how you say Spies. Anyway, so basically, kids, and I mean adults too, adults have all of this,
Hmm.
assuming, no brain pathology, all of that,
Right.
right? But for kids, they have to grow to understand that death is universal. This is the first one, right? Every living thing will
Hmm.
die, right? Death is irreversible. So people die and they don't come back. This is permanent.
Hmm.
Something has to happen to cause the death, right?
Mm.
Either the heart stops because of a
Hmm.
block or a head injury, there's a mechanism. It doesn't
Right.
just randomly happen.
Hmm.
Um, this idea of non-functionality is the fourth piece. So, dead people don't need food. Dead people don't go to the bathroom. Dead people, they do not do anything.
Hmm.
Um, and then the last one, which is actually kind of new to me, just in terms of this framework, it's not a new idea, but just the idea of non-corporeal continuation. So there is a possible way to have a connection and a relationship of sorts with your person even after they're gone,
Yeah.
right? So thinking about Piaget's model, right? young kids, right, might be struggling to even understand that everyone's going to die or that
Right.
death, right? Because I hear parents say things like, kid is saying things that are kind of borderline disturbing about, okay, but when
Mm,
is dad really coming back, right?
mm,
And then
mhm.
so they'll say to me, do they not understand yet?
Mm,
Why, I keep on telling them. And it's like, okay, no, this is just part of it, right?
yeah.
Be ready to have the same conversation again and
Mhm.
again and again and again, gently, kindly, but just like, hey, no, daddy's not coming back because
Yeah.
daddy is dead and dead people stay dead. And we
Mhm.
miss it so much,
Mhm.
right? Um, so the unique part of this experience, I feel, is that as a kid develops, these grief wounds, if I can say it that way, get reopened at each stage of their development because their understanding of what's
Yeah.
happened gets more and more and more nuanced, more advanced, dots
Yeah.
connect. Yeah, yeah.
That
So,
makes so much sense of how, like,
yes,
even though, like, and I think that's what we're kind of seeing with the grief cycle
yeah,
is like, yeah, like you can be, in maybe more towards an acceptance phase of it.
yeah.
And then in a couple years or something can happen.
Mhm.
And it's almost as if you're reliving some of those other stages again. And that
Yes,
makes total sense, at least in these
yes,
kids and adolescents, where it's like, well, their
yep.
brain is understanding this in a completely new way and
Mhm.
feeling these feelings again and thinking about these things, asking new questions. And
Yeah.
that's normal.
Absolutely, absolutely, and kind of back on the language piece of it again too. Think about all the ways that we talk about death, the euphemisms we use,
Mhm.
like, if it's a pet, put to sleep,
Mm,
passed away, passed on, with Jesus, with God, whatever belief system, right, the
right.
person may be. And I'm not gonna like wholesale write that off, right? Because I mean, I think it means what it means to that person.
Mhm.
Language is fluid and subjective, but for a young kid, right, who very appropriately is very literal in their understanding of language and these
Right.
concepts, this idea that grandma is sleeping. She's not coming back. She's not waking up is terrifying,
Yeah, because
right?
guess what? Guess what everyone does at
Uh-huh.
nighttime or during the day
Uh-huh.
is we go to
Yeah.
sleep. And so for
Yes.
us, we can
Yes.
understand the two different meanings
Yes.
behind that. But
Mhm.
someone who's taking that very literally, I can
Yeah.
understand why that would be very anxious for a small child then.
Yes, 100%. And so a lot of times that does see, it comes out like, oh, maybe problems with the bedtime routine, right? That
Mm,
never happened before, right? Clinging to the parent or shadowing, right? Around the house,
yeah.
difficulty being alone. Then often, and I'm sure you've seen this too. These emotional, very very powerful emotional experiences showing up as physical symptoms. So
Hmm.
in school, it's not uncommon for a grieving kid to be in the nurse every day.
Yeah.
Headache, stomach ache, I don't feel right. Right. A
Hmm.
lot of times that's anxiety.
Hmm.
It's sadness. It's a level of burnout, right, from processing your loss in the background while
Hmm.
trying to focus on times tables. How do
Ugh,
you do that?
right.
How do you do that? You
Apparently,
know?
we're just like a intro psych book. 'Cause I'm also thinking of like Maslow's hierarchy of needs
Uh-huh.
too, of like how
Yes.
are we supposed to
Yes.
be doing these other things when like to some people that can shake up the safety of somebody. Like that can be really
Mhm.
scary. And especially if it's, a close
Yeah.
attachment caregiver, like, yeah, how are we
Mhm.
supposed to think about I need to pay attention in this history class when
Yeah.
their whole world may have been just shaken up?
Absolutely. And so a lot of times what that will look like, I think about it as like internalizers and externalizers, right? 'Cause
Mhm.
some kids will show you how they're feeling, right? With their
Mhm.
behavior. They'll be the kid throwing the chair, the kid having the meltdown, the kid, being aggressive, all the things, right?
Right.
Other kids, sometimes I hear this about like, sometimes even in the same family, right? Okay, we don't have to worry about our other kid because she's
Mm.
quiet and, actually she seems to be doing better in school right now. She never seems to need anything. We can always count on her. It's like, okay, well, maybe she is holding on to more than it seems, right?
Yeah.
So a lot of times we do see the two extremes. So if, a kid looks like they're doing well, maybe suspiciously well, I would always say kind of ask some questions there,
Right.
right?
And also just like, yeah,
Mhm.
being curious, being open, not
Mhm.
assuming anything. And I think that's a
Yeah,
big cultural change that we're seeing is we're not always just looking for those acting out behaviors. There's a lot
right.
more language now, a lot more information and resources for these internalizers that we know like may
Yeah.
minimize their feelings or focus on other things, but it can still
Mhm.
come out as anxiety and physical symptoms
Mhm.
and
Mhm.
long-term other things. So it sounds like a lot of this
Absolutely.
work is like just education.
Mhm. 90% of it, I think. Yes, yes. And honestly, I mean, of any age, I feel like that is what my work kind of in the grief world is
Yeah.
because I believe we come into the world knowing how to grieve, right? We know
Mm,
how to attach, we know how to bond, we also know
mm,
how to grieve when that attachment figure is gone, right? And so much of my work with clients is educating, but I would say more than that, debunking, right? Peeling back all these cultural ideas about how long does it take and um, is there a DSM diagnosis for this, right? I have feelings on that. I mean, just all sorts of different things, when really, I mean, this is a lifelong experience, which
mhm.
sounds bleak and hopeless to someone in like the early days, right? But I think the reality is, you're going to love your person as long as they're alive.
Mhm,
My friend has been dead longer than he was ever alive,
mhm.
right? And I still think about him.
Yeah.
I do. I wonder what he would be like now,
Mhm.
and, being a 30-year old, right? I think about these things. And so I just really, more than anything, I want to normalize and validate for people like, there is no timeline, as cliche as that
Mhm.
is. This means what it means to you. This is an individual process, right?
Yeah.
Yeah.
I definitely like I what I love about that too, and this may be just like my perspective on things,
Yeah.
is psychoeducation and this normalization is also so empowering. So like, yes, just
Yeah.
hearing like, hey, this is a lifelong journey and process,
Hmm.
as cliche as that may be, that's also very
Hmm.
empowering in that
Yeah.
like you're not alone. You're not,
Yes.
oftentimes in our head, we're like, oh my gosh, something must be wrong with me type of thing. And it's
Yep.
like, hey, like this is normal. You're exactly where you're supposed to be. It can change over time, but like it's going to be present. That shows that you cared about this person, and that's not
Hmm.
a bad thing.
Yeah. Absolutely. It's one of those things where it's both a very individual experience, but also universal, right? If we live
Yes.
long enough, we will lose someone close to us,
Yeah.
right? And it's one of those just kind of baffling things where everyone thinks that they're more alone than they are, right? Like everyone thinks they're doing it wrong. Everyone thinks
Mhm.
that they're getting grief wrong. And it's not that, it's that nobody's talking about it, right?
Yes.
Even the 5 stages of grief. I have people like ask me like, oh, or say things like, I think I've moved from this one to this one. And, it's kind
Like,
of like
wish it was that simple.
I have to bite my tongue sometimes. I'm like, okay, give it a week. Let's see where we are. Right.
Yeah.
And not to say that there's no such thing as forward movement and grief, but I think the reality is these are themes that we circle back on
Yeah.
over and over again, these buckets that we kind of hop around in,
Yeah.
after a loss always. Right.
Yeah.
It was never meant to be applied to straight grief after losing a person. I don't know if you knew that, but that model, Elizabeth Kubler-Ross's model, was developed for people who had learned that they had a terminal illness.
Oh, I didn't know that.
Uh-huh. Yeah, it was, I mean, she did beautiful work with that specific population, right?
Yeah.
Um, and and so because a lot of people ask, like, okay, I don't understand the whole bargaining thing. How does that fit
Mm.
into, that's not part of my experience after I lost my, friend or whatever.
Hmm.
Okay, yeah, but look at someone who has a terminal illness and how
Like,
often thoughts are
that makes
there
total
if I
sense.
can just make it to my grandchild's graduation, whatever,
Hmm.
right? Yeah, so it she did wonderful work for a specific population and it got grossly over applied. And the result now is everyone who loses a person close to them thinks they're doing it wrong because it's not this tidy thing.
Right. And I always
Yeah.
often say like education and like some of like when things become, like these hot topics or buzzword type things, like there's pros and cons to
Mhm.
everything. So it's
Yeah.
like, yes, I'm glad
Yes.
there's awareness of these different
Yes.
stages people go through, and it can be really helpful to have language and like, okay, like I can
Hmm.
almost anticipate I may experience some of these things. But the
Yeah.
con of that is like, well, like you said, if we apply this just very, linearly, that's not really accurate for probably most people's experiences. And we have
Totally.
to, it's a lot more nuanced than that. And it might not,
Yeah.
be this nice little stair thing where you're like, oh, I'm on this stage. Goodbye, grief. Goodbye.
Right, 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 absolutely, and I hear people say things like, "Oh, I think I've moved on. I don't think I'm grieving anymore," and I'm never gonna it would be so invalidating if I'm like, "Actually, I think you're wrong, client,"
Right.
right? Like, you are. Like, I'm never would I do
Oh,
that, but, I think, I where I go with that is just trying to foster a little bit of curiosity, right,
mhm.
about what is your idea of your grief experience? What
Yeah,
might still be here,
yeah,
right? What do we do if things get difficult again, right? What's
exactly.
feeling meaning? So I do a lot of acceptance and commitment therapy. Like, where are you living out your values?
Mm.
Yeah, yeah. So it's just, I mean, I just feel like, to your point, like two things can be true, right? I'm
Oh,
so
yeah.
glad that people are talking about loss more. And I would say certainly in the last few years with everything, kind of gesturing to the world. But um, at the same time, too, I think that there's a lot of messaging that makes people feel more hurt, more isolated.
Oh, yeah. That was one of the things
Mhm.
that I was curious about too, and I'm glad you actually mentioned that a little bit ago of just some of the myths and maybe like stigmas or barriers in our society. Because again, like yes, we have come a long way, I think, in talking
Mhm.
about mental health and talking about grief and learning and understanding grief. We still have a ways to go. And so, are there
Yeah.
common just like things that you notice of whether it's the barrier piece, the stigma piece, the myth piece?
Mm. Yeah, I mean, there's a whole lot. I have this, like, idea in my mind of, like, turning over a rock, and there's all these bugs under it,
Right.
right? But, I would say, especially as it pertains to, kids and teens, I feel like there's this idea in, a lot of parents' minds, and this is not to blame anyone because obviously we don't know what we don't know, right?
Right.
But there's this thought of if my kid isn't talking about it, they're not thinking about it, which is
Mm.
not
Hmm.
um, I can almost guarantee that, right?
Yeah.
I work with a lot of adoptees too, and that is the case in that community too. Just the idea of thinking about your first family, right? Even if you're not saying it. And so I think that's really one big thing is this is hard to do if it is a loss of a parent because then the other parent might be grieving the loss of their spouse or partner, right? So it is
Right.
kind of a balancing act of trying to meet everybody's needs, right?
Hmm.
Um, but for better or for worse, the onus is on the adult to open the door for these conversations.
Yeah.
I mean, just even simple things like, I was thinking about mom today. I wonder if you were too,
Mm.
you know? Um, especially with teens where you have to have kind of those like duck and run conversations,
Right.
where it's like, okay, just like plant this little seed, leave it there, see what they do with it, right?
Yeah, like don't expect like a 2 hour like
Yeah.
heartfelt like some
Mhm.
teens are into that, love that,
Sure.
but also you might
Yeah.
get 30 seconds of a
Yeah.
vulnerability and that
Yeah.
might be it for them.
Yes, yes, that might be, that might be too much,
Mhm.
but it's like those conversations, can happen over text, right? That
Yeah.
feels a little bit less intense, happen in the car, where you're not facing each other eye to eye,
Yes.
right? That
Oh,
feels a
that's
little nice.
genius.
Yeah, I don't know if you know Lisa D'Amour, the psychologist. She has such a good parenting podcast called I think it's Ask Lisa.
Oh.
But yeah, so she talks about like shoot, is it her or is it the puberty podcast? Anyway, one of those two. But just this idea of if you have something hard to bring up with your teen, do it when you're 2 minutes away from the house because then you both know that you have an escape, right? If the conversation gets awkward.
Genius.
Yes, yes. So there is a lot of mental load on parents. I hate to say
Mm.
that, in families where there's a loss, right? And so I never like, I think really the biggest thing is just saying, like, okay, this is all in a perfect world. Everything I'm mentioning to you is in a
Right.
perfect world. Here's the way this would go. And we don't live in a perfect world because, I say to folks all the time, you know, I love that I know you and I wish I met you a different way, right? I say that
Yeah.
to, my grieving clients,
Yeah.
because it's like, okay, loss brought us together, right? You're only in my office because the worst thing happened, right?
Right.
Um, so I say that just to say all the grace and compassion for parents who are supporting a grieving kid or teen, right? Especially while they're
Oh yeah.
grieving
Oh yeah.
themselves. Um, yeah, but I think it is really on the parents to normalize talking about the person who's
Mhm.
missing. I say missing, what a euphemism that is, right?
Talk
That
about the
needs to be
language. See,
yes.
we're still growing too.
Always, always. Yeah, yeah. So clarity and language, I you know, I her if kids are asking a question, they're capable of handling the answer,
Mm,
generally speaking, right?
I like that.
And so sometimes there's this worry from parents of like, what's the right amount to share? How honest do I be? Can they handle it? I feel like that's a common one. It's like, what does that mean though? Like, what does
Yeah.
not handling it look like,
Right.
right? Um, I think that if a kid is asking, they're ready for the answer. If it's given, obviously, in a way that's mindful of their developmental stage
Hmm.
and personality, right?
Definitely.
Um, you know, don't give them more than they're asking for, right? If a kid says something like, "How did daddy die?" I'm thinking like elementary school age kid here.
Mm-hmm.
It's something appropriate to say, age appropriate might be something like, daddy's heart stopped pumping blood and
Hmm.
oxygen to the rest of his body, and without blood and oxygen, his brain couldn't live,
Yeah.
right? Um, and then when our brain is not working, then our body dies.
Hmm.
And this is rare, right? That's important too. This is rare. And when this happens, doctors usually help. And
Hmm.
in this case, they couldn't,
Hmm.
right? That is factual. That is
Hmm.
in plain language. That is sad and a hard truth, but it's as hopefully like non-confusing as we could make it, right?
Right.
Yeah, yeah. So it's hard.
Yeah.
I encourage parents to have their own support too, whether it's a therapist, close friends, cleargy, whoever it may
Mhm.
be. Just because this might be a situation where it's like you want to brainstorm for some of these conversations first rather than flying by
Definitely.
the seat of your pants,
Right. Well, yeah, and even especially if it's
Yeah.
someone that like both the parent and the child knew, like so like they're
Mm.
going to be in their own grieving process too. And so there's thankfully a lot of supports and hopefully decreased stigma to go reach those
Mhm,
out. As you were talking
mhm,
too, I was thinking
yeah,
if there's like even generational differences, right? Like I'm
mhm,
thinking about the cultural norms that like the kids and the teens these days are tend to be, very open with their
yes,
emotions and talking about things and mental health stuff. Whereas
mhm,
like I know like my parents' generation and my grandparents' generation, it wasn't really safe to talk about those
yeah,
things. And so if we have a parent who grew up with these type of norms or this is how their parents responded to maybe loss and grief, well now you have to
mhm.
not like you're breaking all these cycles and norms to now help support your child. Like that sounds very overwhelming.
It's so, so, so much, and, it's like I don't know, and there's this other thing I see sometimes where people feel like they have this, like, need to do grief perfectly, right? Whatever
Mm,
that is, um, where it's like, I tell people all the time, like, I might throw some ideas out there, right? But if it doesn't work for you, it doesn't work. You know yourself and you know your kiddo best,
mhm.
right? I might have, the knowledge of having worked with so many families dealing with this and this, training I have, but I don't know your kid as well as you
Mhm.
do, right? You know how they're likely to react to certain things,
Yeah.
you know? And so really empowering the parent, that's what when I work with grieving kids, especially young kids, I really, really like to do frequent sessions with just the
Mm.
parent or parents, depending on
Mhm.
who. Um, because I feel like, especially with working with young kids, if there's any change that needs to be had, it's going to be through the parents because the kid
Yeah.
doesn't have the level of agency to change the whole family system, right?
Right.
Which is, sometimes some families expect that. And it's just not, but I love when parents are willing to be involved because
Mm.
this is where it's going to come from is
Mhm.
how do you advocate for your kid at school, right?
Mhm.
When maybe they're getting sent to the office every other day because they're, dysregulated in class and picking fights with people,
Right?
right? One good thing that I suggest that parents ask the school is if the kid can have like kind of a no questions asked standing permission to either go to the restroom or go to the counselor's office, right?
Oh,
Have a
yeah.
code word, right? Because some kids feel like, I don't want to do the thing where it's like it's obvious to my classmates I'm going to the counselor because I'm about
Right.
to cry, right? But even just this idea of like having, I don't know, a code word together,
I
for
love
I need
that.
a break, I need a break, I need to calm down, I need a sip of water or a snack.
Mhm.
Um, it's it is just too hard for grieving kids to do normal school more often than not, and I don't care if it's 1 month out, I don't care if it's 1 year out, I don't care, because of this wound reopening,
Mhm.
right? Um, it's not always right after the loss, but I feel like what happens more often than not is sometimes it doesn't even occur. Like the school, and I'm not blaming anyone, right?
Right.
But it just doesn't even occur to the school that this could be part of what's going on,
Hmm.
you know?
Like there might be
Yeah.
that immediate kind of acknowledgement, but like you said, 6 months down the road, a
Mhm.
year
Mhm.
later, they're not thinking, oh, this
Mhm.
time ago, this major
Yep.
loss happened. And yeah, not to blame them.
Yeah.
It's just a
Yeah.
system that we're
Yeah.
in.
It's nobody's fault, and, honestly, teachers, school staff, everyone's so overloaded anyway, and they're just doing
Yeah.
absolutely heroic work, especially the last several years, but at the same time, I think that these kids are sometimes getting forgotten about or missed or mislabeled, because there is this kind of maybe surface level view on just the behavior, you know?
Right.
Mhm.
That's what's
Yeah.
presented every day, right? It's easy to kind of
Yeah.
see that and then
Yes.
think and make maybe
Mhm.
some of those
Yeah.
assumptions or judgments. And when we dig a little bit
Mhm.
deeper, we can really see that deeper emotion there.
For sure, for sure. Yeah. So I love collaborating with school staff too. I love doing what I can to try to
Mm.
educate on, I mean, even just like autonomic nervous system stuff, right? And like how might this be
Yes.
presenting for this kid? A kid who maybe is very diligent with their work, is the one that you can count on, but who's also grieving, might be in functional freeze, right?
Right.
And may still need care and support and all of that stuff. Yeah.
I love that. It
The
sounds
other
like a lot of the work that you're doing really gets to like
Yeah.
help people just like grieve in the way that they need to grieve.
Mhm.
And like, you mentioned this earlier of not how we're supposed to grieve or, we
Uh-huh.
watch this movie and this is how this person grieved. But it's like, hey, if you need to release some of this emotion, like that's okay. There's safe and healthy ways to do that. If you need to keep things
Mhm.
inside, there's safe and healthy ways to do that. And, just
Yeah.
like there's nothing wrong with you and just helping them identify these things, be aware. It seems so
Mhm.
helpful.
Yeah, yeah, and I think, a big part of my work with families is opening the door for those conversations because often kids, and this can vary depending on kind of their individual temperament and all of that,
Right.
they worry about the surviving parent.
Mm,
Sometimes they're hurting and they don't say because they worry about like, well, I've already seen mom be so sad, you
mhm.
know, um, or mom isn't talking about how she's feeling. Has she moved on? Am I the only one still hurting?
Yeah.
Right. So that's why, I think really the role of the parent there is to just help the kid to know it's okay
Mhm.
to keep having these conversations. Adults are responsible for their own emotions, right?
Mhm.
And the adult is responsible for taking care of the kid. You do see a lot of kind of family system, kind of almost like parentification sometimes on the
Mhm.
severe end, right? But kind of boundary and like family hierarchy kind of stuff kind of come out.
Definitely.
It's interesting. And I want just a special note on teens though, because I do think this is relevant. Um, in situations where a teen has had a parent die, and I think that this is true for people who had losses before who are now teens.
Mhm. Mm.
They can get very stoic, right? Because there's a lot of ideas about independence and maturity, and especially if this has been a situation where it's like, okay, you're the man of the house now, right?
Mm.
A teen can look like they're doing great, but what else do we see come up in the teen years, right? Eating disorders, substance
Mhm.
use,
Mhm.
risk-taking behavior,
Mhm.
you know. Um, so I say that just to say, this is lifelong, and it really, really can ebb and flow, during those
Yep.
developmental years, like you said, up their mid 20s,
Yeah.
maybe even later, right?
Right.
Um, yeah, yeah, it's just what it looks like can just change so much person to person, even in their own life.
Oh, well, I know
So,
one of my big
mm,
takeaways from this conversation right now is that, like, even if you're
mhm,
not experiencing grief and loss,
mhm,
immediately, it's just like the language that we use, like
mhm.
that, oh, yeah, you're the man of the house now. Like, people don't have ill intent when they say that.
No,
They do not mean to
no,
put pressure on anything. But I'm trying to put
mhm,
myself in the shoes of a
yeah,
16-year-old boy, and that's
mhm,
a lot of pressure to be
yes,
put on that. And
yes,
the so like just being aware
mhm,
of the language we use,
mhm,
intentionally or not, and knowing that it comes from a good place,
yeah.
that's just good to like reflect on.
Absolutely. I mean, and other side of the spectrum, young kids, usually 2 to 7-ish, plus or minus, depending on the individual, magical thinking is
Mm,
huge, right? So, say that you're a young kid and your dad went out somewhere, I don't know, and there was an accident while he
mhm.
was out, right? But the last thing he said to you was, be a good girl for daddy,
Mm,
right? what does that do? Did
Yeah.
daddy die because I wasn't good?
Yeah.
Do we develop some kind of perfectionistic people pleasing kind of behaviors
Hmm.
because there's this thought of if I'm good enough, maybe dad will come back?
Yeah.
Um, yeah. Yeah, I mean, there's a whole lot there.
Yeah, I know my brain's going now. Like even just like the, oh, you're grieving so well, like what
Yes.
that implies. And I'm like, oh my gosh,
Uh-huh.
my brain's gonna be thinking about all these messages
Yes.
that we can get and
Yes.
just how we
Yes.
can be clear. I love that of just
Mhm.
like being clear and intentional with this
Yeah.
these having these conversations, being open, being curious. Are there other things
Yeah.
that you think are like super helpful for kids and teens, going through
Mhm.
these major losses?
Yeah. Kids, especially late elementary school, middle, high, it's where, kids are more like kind of outward focused and more socially aware, very, very sensitive to anything that makes them different, right? So this idea of being the kid with the dead mom, right? Like sometimes that's a reputation that precedes you at school when you're a young person. That
Yeah.
feels real bad.
Yeah.
So I'm a big fan of. So here in Atlanta, we have Kate's Club, which is a nonprofit that has a lot of social,
Mm.
recreational kind of activities, camps, things like that, gatherings for, grieving kids and teens, young adults too. I believe they've expanded some of their programming.
Oh, awesome.
Yeah, but I mean, there are different camps. There's Camp Magic. One of our local hospices has another one that they do like once a year, once a quarter, something like that. For grieving kids, it's just like a little weekend thing, but it's a time to just go and be and do some kind of like continuing bonds, kind of memory,
Yeah.
reminiscing kind of activities, and just being with other grieving kids, other people who have
Right.
lost a parent or a sibling. And I think just this idea of having other people that you can look to, it's like, okay, but I'm not the only one who has lived this road, right? There are other people maybe a little further along the path than me, right? Who get it. I think that community is everything. I really do.
Yeah.
We're social species. We die without it, right? So,
Literally. Well, especially how
yeah,
these
yeah,
losses and the grieving process, it can like, I mean, it's a loss of this physical being. And so
yeah,
how important that community can be for
hmm,
attachment and our
yeah,
belonging and our connection. I love that there's hopefully, more resources now, more groups, more support. Those all
yeah.
sound so helpful.
Yeah, there's a really, really good resource based out of, I believe, Portland, but it's the Dougie Center for
Mm,
Grieving Children and Families. And they have a wonderful website, which is Dougie, DOUGY.org. And they have all sorts of education and resources and things like that, even like suggestions for school personnel, right, for how to talk
mm.
about a death. Um, they have like a tool where you can kind of filter out like how to talk to my child who is 7 who lost a parent to cancer, right?
Oh,
And like you can kind of change this on like a fractal way to figure out like what is the most like developmentally appropriate way to
that
talk about
sounds
this.
so helpful.
It's amazing. And they have a cool podcast too called Grief Out Loud.
Oh,
That I
awesome.
really recommend, and so that I share with just about every parent that I work with grief, where there's been a loss in that family, and then of course I have some, plenty of other book recommendations, podcasts, stuff like that too. But I think that's the biggest one
Yeah,
for kids specifically because they
I
just
love
don't
it.
forget what
I
it's
love it.
about. Yeah.
Yeah, and
Hmm.
definitely sounds like it's helpful for the parents just because, yeah, there's probably a lot
Yeah.
going on. So to be able to just like have this resource to
Yep.
be able to be like, this is, how you can say this. You don't have to think about this,
Yeah.
and add that to their load. Definitely sound like those
Mhm.
podcasts are super helpful, those different types of camps and supports. There's books now, like there's just so many things. And so definitely like even just being able to like connect with someone like you who specializes in this, who then can then be like, hey, you don't have to go to Amazon and get overwhelmed with
Right.
5 million results. Like you can talk to a therapist and be like, what are some books that you
Mhm.
recommend? And it sounds like you'd be able to help them narrow
Yeah.
down some of those good ones.
For sure. Yeah, because I mean, I always tell people be discerning because just because someone has credentials behind their name, just because they've written a book or all these things, it doesn't mean that it's going to be helpful for you in particular.
Hmm.
Like you're, reading a book and feeling invalidated by it. Like, I mean, there's plenty of stuff in the grief world that has a very spiritual lens to it, which doesn't resonate for everyone, right?
Right.
And it's like, okay, cool. If that's not for you, skip it. Doesn't
Yep.
mean you're doing anything wrong, doesn't mean you need to force your way through it. There's tons of stuff out there. Don't be afraid to just kind of, like, have this discard pile of stuff,
Yeah.
you know?
Yep.
Yeah.
1,000%.
Yeah.
Well,
Yeah.
this has been so just like, I mean, my brain's kind of thinking about things in a new way. And I think it's gonna
Yeah.
be really helpful for some of these tips and just acknowledgement and education that you've been able to provide. Something that I end all the sessions with is the question, how are you practicing authenticity today? So I know it wasn't like the direct focus of our
Ooh,
chat, but I'd love to just hear how like you are practicing authenticity.
yeah. So I That's such a good question, but one thing that I'm trying to do in terms of authenticity and being genuine is, being very, open with positive feedback, right?
Mm,
Obviously, nothing I don't genuinely mean, but I feel like a lot of times I know this time of year is a little bit rough for me, just, less daylight, it's cold and
mhm.
yucky and all this stuff, and so, really kind of taking that moment to kind of be like, "Oh, I liked this," or "This was fun, this was
Yeah.
enjoyable," which, Alicia, this was so enjoyable. I could talk about this stuff all day long. I had, some delicious coffee this morning. I had,
Yay.
um, a consult group that I love on complex trauma meet this morning. It was a really wonderful discussion, and so it's just these are the things that make me feel like a little fizzy inside and
Yeah.
energized and just like I can kind of go out and just maybe spread a little bit of that glitter, right?
Heck yes. Well, yeah, I mean, I'm just
Yeah.
thinking about,
Yeah.
grief and trauma and like the burnout it can be really prevalent in our field. And so I'm
Oh,
so like it's just really encouraging to
mm,
hear, you practicing a lot of these things that we tell our clients to do. And then sometimes
yeah,
it's hard for
yeah,
us to do it. And
yeah,
so, focusing on those things that bring
yeah.
little glimmers and
Mhm.
gratitude and doing
Yeah.
things that bring you joy. Yeah, especially in this cold, dark time of
Oh,
year. I can
mm,
totally
yeah.
relate.
Yeah. And if I can just add just one little story
Of
just quickly,
course.
I feel like a lot of the time when I tell people that, grief is kind of my jam, right? People are like, they do the thing where they're like, "Oh, hand over the heart, big exhale, like, I could never. You're a
Yeah.
saint. It must be so hard. It must be so sad." And yes, yes, yes to all those things, right? I mean, I'm not a saint, right? But yes, it is hard. Yes, it is sad. And um, it is the silliest, most hopeful type of work I could imagine doing too at
Yeah.
the same time, right? It's the most confusing. It's like I feel like, okay, anxiety, there's a roadmap. Depression, there's a roadmap, right? Like I know how to do yeah, like grief is like the most like amorphous, squishy, weird, confusing experience.
Mhm,
And
mhm.
um intensely meaningful to me. I had a coworker and mentor die a few years ago, and she really was very formative in um, just me kind of setting down on the path that I did, professionally
Mm.
and all of that stuff. And um, there was one session that I had with a kiddo where we were, this is more recently after she died, but we were playing just like a ball toss game, and it kind of naturally evolved into this game that she had impulse control kind of game that she had showed me where it's like we toss it, have to wait for the ball to bounce twice before we
Uh-huh.
catch it, and stuff like that. And so our game naturally evolved into that. And I just felt her there in the room
Oh,
with me and this little kid. I don't know how that works. I don't know, I
I
can't
love it
explain it, but
though.
and I'm even feeling a response in my body thinking about that right now.
Mm.
Just this idea of all of this connected. We are never as alone as we feel. All this matters, right?
Ugh,
And this is why I do it. This is what keeps me going, right? It's just these
yes.
feelings of poignancy and love and
Mm.
just this idea of us all being held by each other. And that
Ugh.
doing grief work just shows me that more than anything else.
Yes. Oh, I love that. What a way to end that
Yeah.
on. And I love how, like, 'cause I know something we didn't get to talk about today, but I know humor is important to a lot of the work that you do and how these meaningful,
Mhm.
deep, connections to these people who have
Yeah.
died came out in this playful way. And it doesn't always
Mhm.
have to be serious and sad. It can be
Yes,
playful, silly, confusing, and to just like
yes,
feel that connection and help others be able
yes,
to feel those connections with their loved ones. Um,
yes,
it's
yes,
so meaningful work. Oh my gosh,
yes,
thank you for sharing
yes.
that.
Yes, yes, yes. Well, thank you for, creating the space and listening and being a witness to all my rambling.
Oh, I'm a rambler too, so we're just being authentic here. Well, thank you so
Yes.
much. I'm going to
Yes.
post Kaylin's info so you can learn more about grief, about working with her, about maybe any resources she is going to share. So I will post all that. So make sure to follow along. Thank you again for being here. And
Yes.
until next time, take care of yourselves and each other.
Mhm.
And remember that the world needs the real you. So let's explore that authenticity together.